My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today I would love to introduce the founder and CEO of Amenities, Aasim Saeed.
Thanks for having me.
Yeah, I really appreciate you joining. So walk me through. You're a doctor by background, but I don't think you practiced medicine and decided to kind of move into a different career path. Walk me through why you chose to do that and, how you ended up eventually joining McKinsey.
Sure. And this part's going to bring tears to my two physician parents who are still wondering when I'm going back to residency here. But yeah, I grew up in a household of physicians, and so I was very keen on that as a profession. A lot of math and science growing up, and the first probably idea that it was actually not going to be medicine long term though was because I started taking all the pre-med requirements my first year of college, but then decided I should major in something else if I'm going to be doing this for the rest of my life. And so that became political science. I actually followed that up in med school with a joint degree in public policy. So I split time at Duke for medicine and public policy at Harvard. And that afforded me, I think, the luxury of something that probably changed my life, which was I had the scenic tour of medical school. There's not exactly like summers in med school, but when you do the joint degree, and especially if you split in different places, I actually had the opportunity to do 2 summer internships. And so the first one I spent in the mayor's office in Houston under the mayor Bill White and was a health policy intern. Got to write a paper on small group health insurance regulatory market that I'm sure no one has ever seen or read. And that kind of convinced me, hey, I like policy and government, but I don't know if government's the way to do it for me. And then the next summer, I was very fortunate. I landed a very competitive internship with McKinsey. And that was something that I was exposed to because I'd heard of like 1 or 2 other physicians in my network who had done that afterwards. So I was aware of it. And it's kind of a testament to just the pathways we can follow if we're even just made aware of them. Doing it all differently, I probably would have done a very different path. But I was aware of McKinsey, so I got involved. I was really fully planning on just doing the internship and then going back into residency, emergency medicine or surgical. But I really just fell in love with what we were doing. I mean, the policy and political science bent obviously kind of lend itself for me being a macro level systems excitement type person. And McKinsey is just an amazing training ground for that. I mean, it is specifically like day one, completely uneducated and unsophisticated in this. They're like, here's the boardroom that you're going to sit in and you're going to learn and you're going to speak. You're not just going to be there as a note taker. And so that was really fantastic training. And now I even describe it sort of, well, I didn't do a clinical residency. McKinsey was really my residency in the U.S. healthcare system, and especially for healthcare providers, where I spend most of my time.
Did you find your way into McKinsey's healthcare vertical by accident, or was that intentional?
Oh, yeah, it's fully intentional. I mean, in fact, I had kind of the opposite problem. So as a physician in healthcare, they recruit you with all the glamour that they recruit you with McKinsey. But a lot of us are self-selecting. We want to work in healthcare. But then I guess where it gets a little bit more challenging is when you try to get out and do something else. They promise a lot of stuff when you're coming in, but then they're really like, you want to do telecom? You want to like if you said you want to do something else, like they recruited you pretty heavily for that. So they like McKinsey. There was this one engagement we did in the Middle East where we were doing helicopter EMS strategy and procurement, and the McKinsey team that they put together was literally 3 doctors and 2 former helicopter pilots from the military. And I was just always like, who else is competing with this roster of a client team that we're putting together? So yeah, they want you to do those types of things. It was a privilege to do it. I just wanted to get some perspective, and really it was more about international health systems, less about leaving healthcare. So I spent a half a year to a year internationally in the Middle Eastern markets and the European markets, and it was really educational, frankly, to see how things are different and the opportunity to help advise and structure more nascent healthcare industries.
How did your early experience at McKinsey really help you throughout the rest of your career? Like, what are the lessons you continue to benefit from that you learned over there?
Sure. I mean, I think the biggest thing that you get out of McKinsey, and it's still the biggest reason I recommend it, is what they call the consulting toolkit. Um, it's hard to know. I'm sure they have a definition for it on their website or something, but it's hard to say exactly where that starts and stops, because people that are recruited into McKinsey are already very type A. I mean, top schools, really good SAT scores. I remember when I first started at McKinsey, one of the partners I was working with was not only like a Stanford MD, but was an Olympic medalist. And so it's intimidating in that sense, and a lot of Rhodes scholars and whatever. But so you're going to be kind of high achieving and driven to work. I think one partner said is a place of underconfident overachievers. So like they also really good at like saying, hey, if you don't do great, or we're going to grade you, and then you just keep wanting to overperform or overwork yourself for it. Um, but I think the consulting toolkit, as I would describe it, is how to structure a problem, how to consider as many variables as possible, the concept of MISI, mutually exhaustive, collective, or mutually exclusive, collectively exhaustive variables that go into that problem, and then also just make sure that you're kind of systematically trying to address each one of those. I mean, this is not something I don't think they advertise or proud of, but like just being able to put together slides and tell a story that is logical. I mean, that's one thing that it's funny, even now we're an early stage startup and people see our slide decks and they're like, those are amazing. And I'm like, well, I mean, I'm not an amateur at this. It's not like I just started, but it's also funny to get like VC um, feedback on our slide decks when you've been a consultant and you put that. Now, they're different things. Don't get me wrong. We can always refine, and the story is much simpler for venture than it is for consulting and clients. The flavor and the dynamics and the design are obviously very different, but at the same time, like those things are kind of assured from anybody who's gone to McKinsey. You know that they have horsepower. You know they have some structured thinking, um, but I think one thing that I also am not necessarily critical, because there's plenty of really amazing entrepreneurs that have been former consultants, but it is also a place that you get repetition on the status quo, if you will, to some degree. Like it's more of an exception than a rule that the folks coming out of McKinsey want to change the dynamics rather than just, become an executive at um, a business or a large corporation that is doing well and they know how to tweak those levers. I think starting over from scratch at a young, scrappy, self-funded, bootstrapped, whatever you want to call it, startup is not a norm coming out of McKinsey, unless it's maybe the analyst class, which are just younger in their professional career, and so they're willing to do that because they don't have kids or family.
I'm just thinking about the slide decks you're mentioning and remembering, I forgot what the show is called, but with Don Cheadle and Kristen Bell.
House of Cards.
Yeah. I just can think of, that show and, how much went into their pitches and, how like the thrill of victory when they won a big client.
Yeah, and that's, by the way, part of why I left was like your product was a slide deck, and I got tired of that. Which is not to say again that there isn't smart and important strategy you put on a slide deck. It's just that you don't see it through typically, and it's changing a little bit. I mean, management consulting at its heart isn't implementation, operations, etc. But that's changing at McKinsey. But at the same time, like I wanted to see more things through, and then really I started falling in love with technology and products. So that was about the time limiting factor for me.
Yeah, walk me through, leaving McKinsey and eventually starting Livewire. Not LimeWire, the song pirating site, but Livewire, which got acquired by H+R Block. Walk us through, what business that was and like why did you choose that, considering you had like a whole background in healthcare prior.
So we started off in healthcare, and this is going to sound silly on the other side of the COVID now, but in 2014, when I was leaving, we were doing the idea was to leave to do telemedicine, but after a couple of months at it, we were like we thought two things at the time, which again are quaint now in hindsight. Which was one, we're too late. Teledoc exists, and there's 10 other market leaders in telemedicine. There's not really much to add, and again, on the other side of COVID, that sounds quaint and silly. But at the time, it felt like there were giants that we didn't have really unique competitive advantage to go about. I think we obviously I would correct a couple of those assumptions now. Um, but we pivoted. We also just looked reasonably at like what are markets that are grossly inefficient in terms of like how do you match supply to demand, just like any kind of marketplace analysis. And then my co-founder honestly had a background as a tax professional in college and afterwards. And so when he looked at that, I mean, I hadn't really, I was just out of school, so I hadn't like done my taxes a bunch. But when I looked at the market, I fundamentally agree. Like not a lot of people realize because they think of Intuit and H+R Block as such dominant players in the field. 60% of that market is independent small mom pop shops. And so I think something like 20% is software, 20% was big three, H&R Block, Liberty Tax, and Jackson Hewitt, which is a former H&R Block person. So it was purely just looking at a market that said this could be disrupted. Now, it had challenges. It is hugely seasonal. I mean, so is retail. I mean, didn't realize that at the time, but I mean, talk about a seasonal one. January through April is obviously massive. There's late filings in October, et cetera. But so there were challenges nonetheless. But so what we built at Livewire was a two-sided marketplace for tax, accounting, and financial advisors for people to find them, but then also like this, and we're kind of seeing the world post-COVID do this, is to interact and to do that, to work with those professionals. And the obvious part of this, again, post COVID, this seems so obvious. But at the time, if you can imagine, pre COVID was that was unheard of. You kind of drove around looking for one. We asked people, like, how do you find your tax professional? And the majority answer was, my dad had a guy. And then if you didn't have that, which was the majority.
That's how I find mine, you know?
Yeah, and it is today. That's just still crazy. Like, unless you were like, I either do my own taxes, which again, people think is the majority, is the vast minority. People are finding these mom and pop shops or they're doing this. And so we were like, okay, that's not good, because the reality is, one, there's like three layers of tax professionals. There's CPAs, there's enrolled agents, and then there's just kind of amateur hour, right? Like you can do anything, hang a shingle. You don't have to have any regulatory degrees or anything. But rather also that there are, like in everything else, there's specialization. There's probably some accountants who are good at restaurants and small businesses and medical careers and other things, and yet we just kind of like stroll into somebody's office or call around, and it's really not a great idea. So we thought a marketplace would help that, just like it would with Home Advisor for contractors and other things. And so, yeah, we started to build that for a little while, and then, not terribly surprisingly, H&R Block and Intuit pay attention to anyone who starts a company in that world, and it was like us, Visor, and like one other company. And so we got an invite pretty early coming out of an incubator to check out and start talking to those big players, and eventually went with the acquisition with H&R Block. But I think for me, especially, it was an early stage acquisition. We were kind of acqui-hired in the company, but that wasn't something, to your point about healthcare, something that I was wanting to do for the rest of my life. And so I quickly kind of migrated back into healthcare.
Yeah, and you did, I think, health system advisory for a little bit, and then you got exposed to Baylor Scott and White, where you worked, I think, full time for 4 or so years.
Yeah, so and interestingly, I had served Baylor as a client prior. That was just kind of happenstance, but I'm
Back in your McKinsey
days. Yeah, so pre-merger, pre-Baylor merging with Scott and White, I'd served Baylor, and yeah, so I started working with health systems because I think the best part of the very unpredictable planned or unplanned career path that I just described was being a physician outside of healthcare when I was those couple of years at Livewire, and I fell in love with product and technology and really just embraced that. And so now, so much so that I would say I kind of fancy myself more of a product person than a physician. I happen to be a physician. Now, I'm probably not the best product person in the world, but I like to think I'm one of the best product physicians you'll ever find. And so everything's a product problem in my eyes. And then when the opportunity at Baylor Scott and White came up and they found me, it was perfect. I mean, obviously, I had a lot of experience in healthcare system strategy and other things, but more specifically, they were starting what was called, or they had just started right before I joined, what was called the Digital Health Office. And that was the department that I would manage at my departure. And that was just obviously an opportune time. That was 1 or 2 years. That was 2 years before COVID. But interesting, I remember I had done an application for this program that I ended up doing during COVID called the Presidential Leadership Scholars Program. And in 19, I had applied to that program saying I want to help make Texas the #1 state for virtual health, and that was part of my job at Baylor Scott and White. And so, yeah, the opportunity for healthcare to start adopting the technologies that I had built in the marketplace, some of Livewire, just to take one step back, was so analogous to healthcare. Literally, the marketplace, you can go to it right now, but bswhealth.com is the best healthcare website in the country. And that's not saying a lot. Healthcare is typically not a high bar when we say stuff like that. But in terms of just understanding SEO, understanding local directories, understanding filters, sorts, and preferences like that, that was entirely translatable. And very fortunately, Baylor Scott and White was an environment that they listened to a lot of those things that I was saying when he came in. So one of my first major projects at Baylor Scott and White was to consolidate 250 websites into one, and to build up the SEO. The website jumped automatically from like 40 domain authority to like 65 when we consolidated all of them. But then also really power the experience for consumers on it. And it's still remains today one of the only websites in the country that is sorted by next available appointment, because we wanted to make the sort and the filters reflect what consumers are looking for. And healthcare has just been so bad at that. So all of those things were really applicable, let alone what also was the premise of Livewire was not just to find a local tax or maybe not even local tax, accounting, financial advisor, but then to also have the integrated tools to interact with them so that you could hit call right now and the video would pop up, and then you have document management, all this other stuff. So that was all the stuff we built at Livewire. And again, once telehealth started becoming a thing right prior to COVID, we had made all these massive investments. So I started to lead most of the virtual health initiatives there, the technology side. I didn't want to manage the people. And it was just amazing. Like we were so kind of dumb luck. We had made massive investments in digital first consumer experiences and virtual health right up until 2020. January 1st, 2020 was when we launched My BSW Health to the public. It's when you could do all these virtual things. And then, of course, COVID happened and utilization went through the roof. So, yeah, a lot of things that were applicable as I came back into healthcare, but way more of a product focus. I mean, being a doctor helped. Doctors would yell at me less in meetings because I was also a doctor, but it wasn't really the clinical side that I was calling back on. But I did, it helps me a little bit in things like what is it called? When we would do physician directory, part of one of the big problems with physician directories and matching is people don't open specialist schedules, for example. Like no specialist wants to have their schedule exposed to the public and people can just self-select because they're worried they're going to get the wrong patient. Meaning you're going to have, like, for example, a foot and ankle orthopedic doc get a patient with an elbow injury, and they've both wasted each other's time. But of course, with a specialist, that's hugely costly. And so you barely ever see that across the country. And part of that problem, and that is kind of clinically related in the background, is we don't know who's anything besides an orthodoc. We don't know their subspecialization in any sort of way because those are kind of unofficial subspecializations. They're fellowships, but they're not actually categorized that way. So you can't really ask a wizard that question because that data doesn't exist. And so those are little insights where I'm kind of matching a little bit of clinical background, but more the structured product thinking of how does a filter work and things like that.
I have another industry that I can think of that is wildly inefficient. It's not the recruiting function, but there's a similar market that I think could be really helpful. So I'm not going to say it on live broadcast, but I'll pick your brain after we're done with this. So just out of curiosity, when you were at Baylor, how involved were you in evaluating vendors that Baylor Scott and White were considering purchasing?
Anything technology related, 100%. I mean, often we were one of the.
Which are some vendors that you evaluated, liked, and ended up purchasing and implementing?
Sure. So some of the key things, we ended up building My BSW Health at the time, and this is not a plug, but like because amenities didn't exist. So we kind of do that now, and there would be no reason we would ever build that again because it was a massive investment. It was like 4 years, $25 million at least. But inside of that, anytime we could buy something and plug it in, we did. So for example, we always thought we could do, but shouldn't do physician directory. The reason I went into that example was because part of building the website was literally just knowing which physicians are actually accurate to your network. And before Kairos kind of broke open that market, But eventually, I would say Find, PHYND, really kind of won that market, and we had both of those in there. So we selected and picked those, and that was a rare case where we said we picked one, and then 1 year later we said, oh, maybe we should change, which is like unheard of, by the way, in healthcare, right? Nobody likes to admit they changed their mind or made a mistake or however you want to label it, but we did. And I should also disclaimer, I like know those teams, and those teams are involved now as amenities because we had such a good experience. But so Find was a great one that we really like. Having a core physician directory that's accurate is a problem for every healthcare system in the country. I can't, everyone that we talk to now, we say, hey, we're about to redo your digital front door. You better check on your directory data. And I give them an out and I say, everyone's wrong. And Baylor it was the biggest time where it just took the most arrows in our back was physicians blaming us. The data had been wrong for 2 decades. It's just when you do a project, they start focusing on it and they come at you for that type of thing. And it's not your fault, but you're like, it's your job to kind of bear it. But we tell that to every health system we work with too. Just be ready. Like there's 2 things that we've learned very systematically. Like one is the physician data is probably wrong unless you are somehow miraculously the exception. It's about to get bad when they start looking at it, and it's almost always the case. Number 2 is the way that the EMR is programmed is not for public consumption. So, for example, patient appointment types. When we do open scheduling and self-schedule appointments for patients, you're about to surface those, and they're going to pick from those. And some health systems we've heard have 30,000 plus appointment types. Now, can you imagine the drop down for you to schedule? You have to pick amongst those, and that's going to be insane. And so we just let them know, like it's by design because you were using them differently. You were using them to customize or personalize the experience for your physicians. But now they're about to be turned over to the public. You need to get ready for that sort of thing. So that's an example of like where we would say you need to really narrow that. That didn't have to do with vendors because that's just Epic and how it's scheduled or any other thing. But sorry, to answer your other question, Twistle was a great one, for example, and that's been acquired by General Catalyst. So we built and made a big investment in something. So aside from video visits like this, which we had gone through the iterations of first trying, oh my God, the default video platform was in Epic at one point was Adobe Flash. I mean, if you think about it, when COVID started, it was Adobe Flash. And then very quickly they were like, oh, that's a terrible idea for large scale. Here, we're going to go to VidYO. That's how I always called it. I think it's pronounced video. But and then I think now they've got their own client, which we've heard anecdotally some people are happy with. But the video client, we went through a couple iterations. We had this thing called Jitsi, which is open source. Then we went to Twilio because we needed better support. And then we finally had Microsoft Teams as the backbone engine. But we controlled the entire interface, unlike most health systems. So that was another one we used. But the other side of virtual was what we call digital care journeys for us, which was expanding a builder. And now Epic's Care Companion is in that space. But before it was companies like Twistle, Health Loop, Seamless MD, and others that we evaluated, and we really liked Twistle and what they were doing, and now it's a part of Health Catalyst. So those are a couple that we really liked, and there were more, but a big fan, and actually ended up using those to the magnitude of like I think we did 1 million plus digital care journeys on Twistle at one point.
Walk me through, founding amenities. It sounds like the idea sprouted from what you built internally at Baylor Scott and White. You realized how labor intensive and difficult that was and thought there was a great opportunity. So kind of walk us through, like, at what point did the light bulb go off and you said, okay, I got to spin off my own company, and do something similar?
We actually kind of pivoted back to what we were doing at Baylor Scott and White. When I was thinking about it, when I was finally one, I think it was just culturally time for me to go. Like I didn't realize I'd missed the startup. Like when you're in like a ramen noodle startup for a while, you're glad to have a job and a salary. But then after a while, then you remember what bureaucracy is like. And so I think it was time for me to get it back on my own. But the other thing that always struck me, and I've been very privileged to make a career now out of trying to solve this problem, was so with that McKinsey or business or entrepreneurial lens on healthcare, I always point this out. Lifetime value is how most industries look at their customers, right? What is the lifetime value, and is the customer acquisition a third of that? Okay, you might have a scalable business kind of thing, right? The lifetime value of a patient in the U.S. healthcare industry is anywhere from the low end to several $100,000 to on the high end a couple $1 million, right? So let's say on average it's $1 million. you are worth $1 million to your local health system, because they typically have end-to-end services, right? They have primary care, they have specialty care, they have everything, right? Do they treat you? Do you ever feel like you're being treated like you're worth $1 million to them in lifetime value?
I don't know if I've ever been treated more than worth a penny.
Yeah, exactly. It's like we go out of our way to be like, screw off. We don't want your business. Like, sorry, I know it says we're open till 5, but we really kind of shut down at 4:30. Please don't call. And we leave you on hold the whole time. No weekend hour. I mean, again, healthcare is like trying to go out of its way to piss off customers sometimes. And yet it's so valuable. And that part just drove me crazy, because I figured, hey, somebody's going to fix that and realize it. That if you can control the life with brand value and loyalty, then all of a sudden you're controlling, again, $1 million of spend, whether it's through insurance. Again, however you want to divide up the pie, from what the insurance gets, what pharma gets, what the health system gets. By the way, the biggest bucket of that goes to health systems. Now, it's not the highest margin by any means. They're low margin businesses, but the biggest dollar amount, almost 50% of that, will go to large health systems with inpatient hospital care, whether it's ICUs, surgeries, procedures, etc. Right? Primary care does not cost that much fundamentally. It's the other things, right? So if that's the case, then health systems should be rolling out the red carpet to everyone. And I always just kept asking myself, why don't they? And when I got in there, I'm very consumer oriented segment. I'll just be very transparent, blunt. I just don't think a lot of healthcare systems are that. They have operators who have gone through the world and excelled and done really well based on their ability to operate hospitals, which is great. It is what the system solves for. You, like, before, I think, a recent time, most COOs was like the most common role right prior to becoming CEO, was COO first of a hospital, then CEO of a hospital, and then CEO of the health system, or COO of the health system, right? That was a traditional path, because that's what you did to operate really well. Then I think strategy started coming in play, and then you started seeing health systems kind of like, okay, how do we get those surgeries and referrals? Let's buy up medical groups, and they started associating. So now all of a sudden, maybe clinical operators became the kind of leadership thing. But that, just to be clear, that bet, the assumption was patients don't decide where they go, their doctors decide where they go. That was the whole premise of the last 20, 30 years of acquisition of medical groups, is to make sure we got the downstream referrals. Doctors are the ones to decide. They weren't working on advertise. I mean, they're advertised, but it's in the silliest way possible, right? The day that U.S. News makes their records shown, everyone's got their merit badge of like, we're the best in gastroenterology, like things that no patient can comprehend. But the actual rollout to a patient making their own choice, they don't even try, right? Like, open schedules. No, no, no. You call the 15 doctors on our list and see if anyone's available, kind of stuff. And so that's the problem I want to fix. And I kept asking myself, why don't they care? Why don't they understand this? And one, I don't think I think there was two deficits. One was, I don't think there's a really good understanding of things like lifetime value, customer acquisition, et cetera. So right now, health systems spend millions, if not tens of millions of dollars on Google Ads. They literally can't close the loop like every other business, because they can't put a pixel on the checkout page, because the checkout page is in the EMR. And if it's Epic, they don't really let you do that well. So they just spend and then hope it shows up on the website and converts into an appointment. In fact, the majority of them don't even have open schedules. What are they even spending for? I have no idea. They're just like, oh, when cardiology is searched in Google, we want to come up. Why? So they can phone call us. Like, that's it. They don't close the loop for online purchase. It's kind of crazy. But then the second thing is, I don't think they have a business model. They just assume that patients will go everywhere. And right now, our numbers show this. We've done 3,500 patient surveys, and we literally haven't found a single patient who isn't splitting amongst major hospitals. So that just means like there is no loyalty. And so the premise of amenities was, okay, the world has kind of shown us. It's not like I invented this. Through Amazon Prime, through Costco, through Apple, every membership, and Netflix, et cetera, that like subscriptions are basically how the world thinks of loyalty and membership now. And so why don't health systems have these things too? And so that was really the concept, is how do we figure out what is the Amazon Prime or the 2-day shipping free returns of healthcare, and put it into a membership that patients will now reward a health system with loyalty for if they just fix their experience. And so, said shortly, it's like, why don't health systems compete on experience? What if they did? I bet the first movers would be fabulously well rewarded, like Amazon was. And so that's the premise of amenities. And then we kind of came back to doing some digital front door stuff very soon afterwards, because obviously we were big experts in that. And we also kind of said, well, people don't want a phone call membership these days. We kind of have to build the digital front door tools to get this experience up to par. So now we do things like your logged out provider search sorted by next available, your mobile application. We register new users off the street into your EMR in 30 seconds, but then also membership. So what are the memberships? What is the 2-day shipping free returns in healthcare? And our hypothesis is, again, based on research, it's not what we all think. I think we see health systems now post-COVID experimenting and getting excited about like virtual primary care models, but that's just because they realize they don't have to buy a building every time they do. They kind of out of convenience, I think. But instead, I would argue that, and I have data behind this, that the number one problem for patients in why they don't utilize healthcare services is cost, is the fear of bankruptcy. Um, there's a study I saw recently that 50% of Americans would either not be able to pay it or would go into debt to pay a $500 surprise bill from a hospital. And so, like, that is a massive concern that's going to keep patients from utilizing services. And I think health systems haven't yet been creative about what do we do about this? What can we do? Because they're often like, well, we don't control the price. That's a payer. There's a lot we can do. And that's what Amenities helps build. Things like no surprise billing guarantees, satisfaction guarantees, transparent cash pay pricing. So we think that the memberships need to be not just access, but also other things that can delight and frankly get the suck out of healthcare experience, and that will be something that's game changing in healthcare.
That's awesome. I love that. Really, really good. Anything else you can share about, why this benefits the patient? I think it's obvious where it benefits the hospital. They're going to keep more patients in the system for the entirety of their life.
Every feature we consider, we try to ask ourselves, is this beneficial to the patient? And here's a couple of really nuanced examples of that. So for 4 years at Baylor Scott and White, we tried to figure out some meaningful price transparency. And without going into too down farther rabbit hole, like that's just not just really hard to do, I think almost next to impossible in healthcare in the US. One, because the long tail of benefits is so far that like there's literally not, this is a company idea if anybody is listening and wants to start a company, is there's no single place where you can access all of the payer portals in the country to know what the benefits are for Norm or for myself, right? So like you can't figure that out in any sort of real-time thing. And people pay with their benefits, right? They don't pay out of pocket for everything. So if that's the case, that's one big problem. But then the second problem, and it's, I'm not blaming them, but it's the reality is patients don't really care about what the price is. They just care if it's covered. Meaning, like, if it's covered, then they're like assuming their benefits aren't terrible and they're going to have some out of pocket cost and some copay, deductible, whatever, right? But they stop caring as soon as they know if it's covered. And so we haven't seen patients really shop a lot unless you're in self pay or uninsured plans or really high deductible, which is happening more and more. So, all that to be said, we said, okay, but what can we do in this arena? And so that's where ideas like no surprise billing guarantee and transparent cash pay pricing came in. We can't solve and tell you exactly what everything's going to cost before you buy it, but what we might be able to do is build trust and say, hey, this health system's on your side. They are trying to give you some protections, just like Costco gives you free returns or Southwest Airlines doesn't charge you for change fees. We think those are the trends and the loyalty programs that we're trying to learn from and say, how do we do the healthcare version of that? It's not just those two. We also, like, Best Buy Total Tech came out a while ago and did really well. The first month, I think it added like $60 million worth of new business to Best Buy. And so they had like this early access where like you get a PS5 before anybody else gets a PS5. We're like, what does early access in healthcare look like? And we tested some concept, but it didn't work. Like nobody was like really understood what we were talking about and they didn't like it. So we're trying to learn from other industries and say, what is the version of that could apply to healthcare? And I think often I get really frustrated when I hear health systems or other folks inside the industry talk about how special we are. We're not that special. Like life and death, yeah, so is airlines, so is legal, so is law enforcement, so are teachers, like unfortunately the last one. But like we're not special. In fact, we just need to figure out, we have complexity, which is really annoying, which is the person doesn't pay themselves, which makes everything complicated. But if you can do something around that, which I think a lot of really cool startups like Goodbill is a fantastic one that does that, what we call no surprise billing guarantee. MD Save is a really cool one that offers cash pay pricing, whether or not you choose to use your insurance or not. So we're looking to partner with these folks and bring this into an experience that health systems can get excited about. So that's that's how that the whole company is designed from the ground up, and the name amenity. We want to be the amenities of the things you like about healthcare, and then just do that in a financial model that makes sense for our paying clients, kind of thing.
And that's where the name came from, is, you wanted health systems to start offering amenities to their customers, so to speak.
Yeah, literally. We always say we're amenities for two reasons. One, we're white labeled everything. We're not. The thing that used to frustrate me. So I was one of the buyers on the other side when One Medical would come knock into health care systems. Hey, pay us to be your consumer front end. You suck. We're good. And I was like, why are we paying brands to come into our market? So it's one thing if you're in New York or San Francisco, but the fact that anyone in Dallas, Texas was saying we should pay One Medical to do our patient concierge practice, no one on the street would know what One Medical was in Dallas, and 10 out of 10 would know what Baylor Scott and White was. But now Baylor Scott and White has a One Medical partnership because it's just silly. And so we amenity. I'm not trying to put an amenities brand on our product because the Baylor Scott and White's the brand, or THR, or UT Southwestern, Medical City, whatever it is, right? Because those brands are powerful. I just to prove that, I always say, if you have a doctor in Palo Alto and you have doctor on the street XYZ and a Stanford doctor ABC, who's the better doctor? The Stanford doc. You don't know anything about him. You're just assuming, and that's the power of the brand, and that matters. So the thing that health systems have best going for them is the brand trust. And right now they're just conceding it with no access. Literally, Intermountain, whenever we look it up, has the earliest access for a primary care appointment is like March. Like today, when you go into the app after you spend 20 minutes trying to download it, you can see a March appointment. What good is that? Whereas Sesame with Costco or Walmart or CVS or Amazon will get you those appointments today. So they're kind of conceding this, even though they have the more appropriate brand value in that market. They're just not meeting the requirement. And so we think if they had amenities that would meet those requirements, that could help. And then the second one is, yeah, we're very focused on consumer experience. We want to delight, but experience is a flavor of financial friction, guarantees, access, kind of things.
Yeah, I love that. Well, I want to congratulate you on getting your Series A recently. Now is not an easy time to raise. I'm just curious, what advice would you give to founders watching and listening to this podcast on, what's some advice on how to get funding in a difficult environment?
Um, I'll do my best here, but it is a tough environment. I mean, I think most things people know that I'll just reiterate is you need to talk to a lot of people. I mean, that's not, it always looks in a press release like, oh, well, we met that person and then they just signed it. It was amazing. No, I mean, that's one out of, I mean, any of the funding that I've done to date, it's been 100 plus conversations for each term sheet. So it is important to be doing that year round. Even now, I mean, I'm talking to potential investors for the future just to have meetings and other things because it's important to get to know folks. And I think also investors want to see multiple data points. So even if you're starting that conversation now, put them on the list, send updates quarterly. They see that consistency. I think you become a longitude, instead of being one data point, you become aligned to them, right? So that's one. I think the other one is um, the days of make believe are gone. So if you're relying on a lot based on a concept, or you're relying a lot because the team you've put together and other things, I think there's a lot of show me going on right now. And so I think that's not to say that people can fundraise on either, again, a great team or a great concept. And that I think you have to demonstrate a lot of nuance in healthcare, especially. And obviously I have a decade now in the industry from a lot of different perspectives, clinical product and systems thinking. I would invite entrepreneurs to look especially at their team and the story they're telling as a combination of, one, we have some real people who've done this before, who know all the pitfalls. But and I never say just do that, because that's also kind of traditional thinking. Like, and then we have everyone who's pissed off enough at the status quo, who's like going to fight that person. But it's going to be tempered in reality of like, what can we build and how does it work within the system? How does it affect copays, or what's the real motivation of an HR buyer and an employer one, if we're saying if there's going to be a per employee per month kind of thing that knows that, but then dream about something better than today. And then really, try to find and anchor yourself in a first or second major client that can align with you on that dream. And so if you can bring those things to the table, you're very separated, I think, from the pack right now, especially because, I mean, again, I forget multiples. We just saw a lot of folks that were doing things that conceptually sounded exciting, but I have so many questions about them. Like, how would that possibly work? Why would that be differentiated? And like, where's any sort of traction that that's a real thing, kind of thing. So I think that's the advice I'd give. Like a little bit of well, you got to demonstrate knowledge in the status quo, but then a healthy disregard for that status quo.
So Series A, that's under the belt. I'm wondering what's next for amenities. What do we all have to look forward to?
Well, one, I hope, and I really appreciate the time here. You're just going to hear more about us. I think, we've been pretty quiet. So we raised a seed round a year and a half ago when we started, and we never announced it. We were just heads down. We had a client very early and started building. We are so excited. The first clients we've been working with will start to go live on a pretty exciting platform here in the new year. And so you're going to see some announcements about that. You're going to see us adding new clients and more announcements about that. But I think the biggest thing for us is we just want to get the word out there, the name out there, because and obviously everyone should be this emboldened to say stuff like that. I think we'll have the best product in market. I think we are very honed in on helping health systems come out of this financial crunch that they're in, and to do it by making a good business that patients love. Not that they obviously aren't doing good work, but I would say it's hard pressed that patients love the experience in healthcare.
Yeah. I don't think any health system I've ever been to has been customer centric.
Yeah. But even though that word gets thrown around a ton, right? So we're like, I hope we can be a path and a partner to really achieve that. And so again, I think this year our goal is just to become known. So you're going to see us in a lot of places that we haven't been before, because we've been not stealth. We weren't trying to keep quiet by any means, but and then we're growing. So we've added new team members, we've doubled in size, and we're going to start showing off those skills and those capabilities here in a way that we've just been more quiet about and focused the last year or two.
That's exciting. As we wrap up each episode, we want to always ask, our guests if they practice what they preach. So we're in healthcare. How do you, participate in health and wellness, and how do you de-stress in a fairly stressful job?
I de-stress. I am a kind of growth-minded or forever learner stuff. One of my team members is all about growth mindset. This sounds somewhat crazy, but I'm 40 years old, and last year I started to skateboard, and so
I like that.
And doing things that are new and challenging, and just the willingness to get. I mean, skateboarding is terrifying when you're 40 years old. Like every little thing hurts now, and so I started it with my kids, but to do that at 40 is something that is remarkably in my top 5 of things I'm proud of in life, which is a weird thing to say, but it's how I humble myself, let's say, because again, kids are doing flips and kicks and ollies and all this other stuff that I'm not doing, but just to get on there is a little bit of a win. Yeah, that's what I would say. Just trying new things and being humble about that. I'm gonna try to get back into something like piano here too, but for me, it's less of like physical. I mean, I need to run and lose weight. I think everyone wants to do that, but it's more of like, do I have something that's completely separate where the ambition is different, but it's sort of meditative without me having to actually meditate. So,
any healthy recipes you make at home that is popular with the family?
Oh, the food wise? No, we are remarkably Costco people, as you've already heard with the membership. Like, I'm a secret shopper of everything, by the way. I've tried every membership in healthcare that I can get my hands on. So Parsley, Forward, One Medical, etc. But even Costco, I'm always like, man, they do it right. You walk in there and you're like, I didn't think I needed a kayak today, and yet like it's on sale and it just looks like a really good price. And that includes the giant buckets of everything they have. They're like spicy blackened chicken and all this other stuff. So no, I'm not doing a ton of cooking. My wife's a lot more known for that in the household than I am.
All right. Very good. Well, awesome. Really appreciate you joining the Digital Health Heavyweights podcast. Really enjoyed this episode. And thank you so much for your time, and thank you for joining. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.